Is the Bayley Scales a reliable test? Have you ever wondered how professionals assess the development of infants and toddlers, especially those who may have autism spectrum disorder? The Bayley Scales of infant and toddler development, often referred to as the Bayley Scales, are a well-respected tool used for this purpose. But just how reliable are these tests? Let's break it down. The Bayley Scales measure several important areas of development. These include cognitive abilities, language skills, both receptive and expressive, motor skills, socio-emotional development, and adaptive behavior. This wide range of assessment helps to provide a complete picture of a child's developmental functioning. When we talk about reliability, we mean how consistent the results are when the test is administered. The Bayley Scales have shown strong internal consistency. This means that if different trained examiners give the test, they tend to get similar results. This is important for ensuring that the assessment is accurate and trustworthy. For the Bayley 3rd edition, also known as Bayley-3, the reliability coefficients for cognitive and language scales are above 0.9. This indicates excellent reliability, particularly for children with autism spectrum disorder. These areas are often affected by autism, making this test especially useful. The latest version, the Bayley-Four, continues to demonstrate strong reliability and validity. It aligns well with earlier versions and other standardized tests. The Bayley-Four also updates norms to reflected current populations, which is essential for accurate assessment. One of the strengths of the Bayley Scales is their sensitivity to developmental weaknesses that are common in children with autism. They can help distinguish between general developmental delays and specific language impairments. This distinction is vital for early diagnosis and intervention planning. However, it is essential that the examiners administering the test are well-trained. They should also consider cultural and linguistic factors when interpreting the results. This ensures that the reliability and validity of the test are maintained across different populations. In summary, the Bayley Scales of infant and toddler development are reliable and valid tools for assessing developmental progress in infants and toddlers, including those with autism spectrum disorder. When administered correctly, they can provide critical information for early diagnosis and intervention.